Heart failure is a condition that occurs when the heart cannot pump blood as well as it should. This leads to inadequate blood flow to vital organs such as kidneys and congestion in other vital organs such as the lungs. The term heart failure is misleading because the heart does not completely fail or stop beating. Although heart failure is a serious condition, safe and effective treatments are available. Treatment can relieve symptoms and help you live longer. What are the symptoms of heart failure? In some cases, heart failure can be mild and cause minor symptoms but are only evident with physical activity. Other times, it can be severe, causing symptoms at rest or even life-threatening symptoms. Heart failure can cause tiredness or weakness or make you feel lightheaded or dizzy. It can also cause trouble breathing, which might lead you to be less active or to need extra pillows at night to sleep. Heart failure can also cause a racing heartbeat even while resting. It can cause swelling in your feet, ankles, and legs or in your belly. Heart failure can cause weight gain, but it can also cause unintentional weight loss in severe heart failure. It can also cause frequent peeing at night. Heart failure is diagnosed based upon your medical history, a physical examination, and a series of tests. These tests can tell your doctor how well your heart is working and can help determine the cause of your heart failure. An electrocardiogram, or EKG, measures the electrical activity in your heart and show whether you have an abnormal heartbeat or had a heart attack in the past. A blood test known as brain natriuretic peptide, or N-terminal proBNP, is high in people with heart failure. A chest X-ray shows if there is fluid in the lungs and the general shape of the heart and large blood vessels in the chest. An echocardiogram, which uses sound waves to create a picture of your heart as it beats, shows the size of the heart chambers, how well the heart is pumping, and how well the heart valves are working. During a stress test, you might be asked to run or walk in a treadmill while you have an EKG or other heart tests. This helps doctors see if the heart is getting enough blood when it is under stress. If you cannot walk or run, you might instead get a medicine to stress your heart. During cardiac catheterization, also called cardiac cath, the doctor puts a thin tube into a blood vessel in your leg or arm and measure blood vessels. This can show if any arteries in your heart are narrowed or blocked. Other imaging tests include CT scan, MRI, and nuclear scan. Doctor can use these to look at the heart muscle and coronary arteries in specific situations. For example, an MRI or nuclear scan can detect inflammation of the heart. A CT scan is sometimes used to examine the coronary arteries